When you look at COVID-19, first of all, is it mutating? And is that why it's back in Beijing? Or is it the same virus that's just come back?
I think it's the same virus that's just come back, Francine. And here's the situation. We are expecting there to be resurgences. This is very much in the game plan. But what will be necessary this time is that nations are able to close down these resurgences and suppress them without it requiring the whole lockdown of an economy. And that should be possible, provided that people themselves know what they've got to do to reduce the risk, and provided you get good quality public health services functioning right across the country. You can deal with this virus and keep life going despite the fact it's there as a constant threat.
David Nabarro, what does it tell us about how we should reopen our economies? Are we learning the best way to do this, given the resurgence in infections?
I think we are. Just to stress, I really don't think we've got mutations right now. We've just got a problem of a virus that is capable of coming back and reinvading societies very, very quickly. And so we have to be prepared for it, and we have to defend against it. Some countries are doing this really well. I do see good progress in China, in South Korea, in Singapore. I see excellent progress in New Zealand, good progress in Kerala state in India, and strong in Germany as well. But many of these countries are seeing small resurgences. They're just dealing with them really quickly. The countries that concern me more are the ones that perhaps are not conscious of the fact that this dangerous virus can come back, and they're pretending that life can go on as normal. I think they're the ones where the problems could be much more serious. So within the World Health Organization and other bodies, we're encouraging all nations, take this virus seriously, get your public health services ready, make sure every single individual knows what they've got to do in order to reduce their risk. Go very local and get the data from a local area and be ready to act locally. And then we can get on with life and keep the economy going.
Dr. Nabarro, you're a very modest guy, and it's without question you are the most qualified person in the world on doing medicine in the trenches, including surviving the Canal Hotel bombing in 2003 in Baghdad, your work on malaria, your work on Ebola. I want you to speak to our audience right now about the efficacy of the budgets of the World Health Organization. Grade for us, give us a judgment, please, on how those monies are spent. There is a belief by many that it is ill spent. Discuss that, please.
Thank you very much indeed. Let's start with the World Health Organization. Brings together medical and public health professionals from all over the world, 7,000 of them in various different roles in 100 and something different offices and 6 regional hubs and Geneva. Total budget of this organization, 1/3 of the United States Centers for Disease Control. And it's asked to deal with every health issue under the sun. I work there. I know the people. I know the organization. It does not waste money. In fact, it's really ridiculously underfunded given the scale of the problems it's asked to deal with. Last point. You know, we do World Health in a political context. Occasionally, our owners, the different countries of the world, are not getting on for some reason or other. But those of us who work in World Health, we continue to operate despite the political buffeting that occurs. But it is getting quite difficult right now with people basically saying we've failed and we're not useful because we operate within the rules that are set for us. And I believe that we're doing okay, but the challenges at the moment are absolutely massive. And I would ask everybody not to be withdrawing money from the World Health Organization just when we're right in the middle of supporting the world, dealing with the worst public health crisis I've ever known.
Dr. Nabarro, tell us the difference in virulence here of this virus versus SARS and versus influenza 1919 and just a general influenza as well. Tell us the difference in virulence and what that means for poor nations ill-qualified to suffer it. What does it mean for a given poorer African nation?
Thanks very much. So this virus is certainly much more unpleasant than influenza. Its virulence is certainly slightly greater. But the thing that really disturbs me about this virus is that it's persistent. It doesn't seem to be weakening as the months go by. And also we were hoping that it would be much softer in its impact on poor countries. But if you adjust for the different age structure of poor countries, it seems to be just as bad. So it is a global phenomenon. I've been looking at the statistics right now with 8 million reported cases. Do you know where the numbers of cases are increasing? It's in Asia, India, Bangladesh, Pakistan, Indonesia. It's in Latin America, in Brazil, Mexico, and other Latin American nations. And it's just getting into Africa, as well as in the Middle East. This is a virus that's affecting poor people and particularly affecting poor countries. They've not got strong health systems. And so as Western Europe and the US seem to be doing better, though the US figures are not good right now, the real challenge is in the poor nations who really don't have the spare cash or the health service capacity to deal with this problem. And I worry a lot about what's going to happen in 6 months, 9 months' time as the virus is continuing to move across poor nations. Are they going to have the cash reserves in their own national budgets, both to look after the people who are being affected and also to deal with the businesses, particularly the small and medium enterprises that are being really turned towards bankruptcy?